Doctors say COVID-19 complacency is on the rise. They're reminding people to get their updated boosters, even as Singapore treats the virus as endemic. A new survey has found that a third of those deemed to be most at risk from severe infection no longer see the virus as a threat to their health. They also do not plan to take more booster shots. Sherlyn Sia tells us more in this report.
Get up to date with your booster jabs or risk ending up in hospital if you get infected with COVID-19. That's the warning from some medical practitioners here as more people take vaccine protection for granted, despite it waning over time. The study commissioned by Moderna and the Asia-Pacific Immunization Coalition involved more than 1,000 adults.
50% of individuals say they are not going to get themselves vaccinated against COVID anymore. So that is kind of alarming, because if we are dealing with a virus that is still causing a lot of trouble here and elsewhere, we should get ourselves protected, especially if we open up the economy and then people go traveling.
That's despite nearly 2 in 5 agreeing that there's enough data which illustrate the need for additional boosters. Attitudes towards the virus have also relaxed. Only slightly over 1 in 10 of those surveyed believe that COVID-19 poses a high risk to their health. An infectious diseases specialist says extra vigilance is needed, especially as people resume normal activities.
There is a misperception about the word endemic. Okay, shifting from pandemic to endemic, to me, as an infectious disease person, is really just changing the label. Endemic means that the virus is still there, and amongst the vulnerable, it can cause severe disease and even deaths. So you need to maintain, for example, the high coverage of vaccination. The basis of it is education, communication, to make sure that people understand that overall it's for the good of the country, in addition to the individual benefit.
He adds that vaccine benefits still far outweigh the risks, and severe side effects remain rare. Singapore reports around 7 cases of serious adverse effects linked to mRNA vaccines per each 100,000 doses administered.